Graves Gilbert Clinic has been here almost 80 years, and we have a wonderful group of oncologists, pulmonologists, urologists, orthopedic surgeons, family physicians, internal medicine physicians, pediatricians, rheumatology, endocrinology, allergy, and I'm sure I'm leaving someone out, but I don't mean to.
The clinic began in 1937. In 1937, it was unusual for a general surgeon and an internal medicine physician to be partners. In fact, it was frowned upon by a lot of people. But Dr. Graves and Dr. Gilbert did that. They shared a common bond in that they were interested in coming to Bowling Green and doing what they could to bring better medicine to Bowling Green. So from its very beginning, it has always been a multi-specialty group, meaning that there were physicians of different specialties united together with the same mission of taking care of patients. And that is the same mission that we have today.
So I think everybody within not only our department or throughout the clinic, we strive to make sure our patient care comes first. The clinic has been an integral part of the community for the past 80 years. We are growing with the community so we can meet the needs of the community.
Being from Bowling Green, I went to high school in Bowling Green, I went to college in Bowling Green. I got to see Graves Gilbert when they were starting to decide to grow and how they were going to grow. And through those 20 years now that I've been involved with Graves Gilbert Clinic, I've watched them grow tremendously, a lot of times cautiously to make sure they were growing in the right direction. And what that means is you never want to get so big that all of a sudden you've kind of outgrown what you were really about. And I think Graves Gilbert Clinic has been about taking care of people like we would our family. And from day one, that's how I've wanted to take care of people here. And I see that every day at Graves Gilbert.
Well, at the end of the day, it comes down to patient care. And that's my mantra. That's a mantra that I have for my staff and reflects really the emphasis of what the clinic is. And at the end of the day, if what your decisions are guided by is what is best for the patient, then nothing really else matters.
My favorite part of the clinic are my patients. Yes, I enjoy the clinic itself, but it's the families that I've gotten to know over the years. I try to think that every patient is the one patient that I'm supposed to be seeing at that particular time. I wanted to go somewhere that had an emphasis on quality, and I think that's what we've tried to do. As my position, I've been involved in recruiting for the last several years, and we're not interested in just filling a space with a physician who may or may not be the most qualified for it. We're here and we want to provide quality care for the region.
We as physicians try to be compassionate and understanding to our patients. We get satisfaction in our jobs from helping people, making people feel better, making them live longer, and in helping them get through some of the toughest times in their life in a way that is as simple and easy and as worry-free as possible.
Each patient that comes into my door, each patient that comes into my office, I like to view them just personally as a family member. If this was my brother, if this was my aunt or my mom or dad, what would I be doing for them? I like to treat everybody the same, and you have to treat people the way you would want to be treated.
A lot of things have changed, but taking care of patients as the fundamental idea of why doctors go into medicine, I don't think that's really changed. And I like the idea of one patient at a time because at the end of the day, a surgeon can only operate on one patient at a time. A family practice doctor or a pediatrician can only see one patient at a time in the exam room. Taking care of patients means caring about them as individuals. And at the end, I think that's what we've done a good job with. It's certainly what Dr. Graves and Dr. Gilbert set out to do when they started the clinic 80 years ago. It was a personal business then, and it's still a very personal business now.